because so many of the senior citizens have suffered. I was one of them with the personal testimony of needing medication a couple years ago, and the out-of-pocket costs for that I could not afford, so I denied and declined to take it. So for Senator Brown to help vote and get the Inflation Reduction Act in place is a major milestone for us, because in our golden years, we want to really prove that there is the real goal in keeping us healthy.
For Pamela Shields, this marks a seminal moment in the fight for affordable health care. As the founder of the Urban Aging Residential Coalition, she says the cost of prescription drugs can be a huge barrier for the people she serves.
I have members in our group that are members of UARC. Many of them live in urban areas suffering from chronic diseases with health disparities. And according to the data points, African Americans who are aging are dying two times faster than our white counterparts. And often it's related to the lack of medication, the lack of the ability to pay for it. Even though there is Medicaid and Medicare, there are still problems and barriers to receiving that type of quality care.
The White House announced Medicare will begin the price negotiation program with 10 drugs, including diabetes, heart failure, and arthritis medications. Those drugs are among the most costly in the Medicare program and are taken by more than 8 million people on Medicare Part D.
We've been fighting Big Pharma for a long time.
And White House Domestic Policy Advisor Neera Tanden says these negotiations could benefit all Americans.
There's nothing that stops private insurance from using these prices once they've been negotiated.
Ohio Democratic Senator Sherrod Brown voted for the Inflation Reduction Act. Brown touts the act for already capping the cost of insulin at $35 and now sees this as the next step to lowering drug costs.
The Secretary of Health and Human Services announced 10 more drugs that they will begin the price negotiation. So they will sit with the drug companies and negotiate a much, much cheaper price. And then we capped overall the price of the cost of drugs out of pocket for any Medicare beneficiary, any senior, at $2,000 a year. So that should make a huge difference in people's lifestyle. People that are older living on fixed incomes, they now have a chance to fight back against the drug companies.
Even with the lower prices, the White House says drug manufacturers will still make a profit. But Juliette Kabansky with the Kaiser Family Foundation explains why